Welcome to Healthwise here on public-funded WTVI. I'm your host, Joey Pop. We're about to explore non-invasive body sculpting. Are we ready for prime time? With us is Dr. Gilly Munavalli of Dermatology Laser and Vein Specialists of the Carolinas. Now stick around as we expect another educational hour. And as always, we welcome your questions. We're going to find out what's new with cosmetic improvements, including the procedure called Coolsculpting. You can telephone, email, or send me a tweet. You can telephone with the number on the screen, send me an email, jpop@wtvi.org. Be sure and add the extra P, P-O-P-P. Or you can send me a tweet if you have a Twitter account, @JoeyCPop. Welcome back, Dr. Munavalli.
Thank you. It's a pleasure to be here again.
Yeah, it really is. It's been a few years since we've seen you.
It's been 3 years. It sure has.
And now you're back. Since we saw you, I guess we were at the beginning of the economic challenging times.
That's correct.
And with cosmetic procedures, did your industry take a hit, and are you seeing an improvement now?
Well, time marches on. There has definitely been a decline, but what we were discussing earlier was that the last 2 years, especially starting last year, at the beginning of last year, there's been an uptick. And there's a lot of developments in the field. People are still interested in looking the best that they can, and I think there's a lot of reasons for that.
And I think what the focus is on this hour, we're going to be looking at this new procedure that's versus liposuction. Is that accurate to say?
That's right. There's a whole kind of branch of cosmetics called body sculpting, and that could involve kind of the one end is liposuction, which is a little bit more invasive. At the other end, you have some of these other procedures like Coolsculpting, which don't involve any needles or any anesthesia, yet give you some improvements in your body's appearance.
Right, and many of you might have heard of this procedure and just wondered what the heck it is, and that's what this whole hour is going to be devoted to. Dr. Munavalli has sent us some interesting animation and also some slides to share to explain what this is all about. But let's just go through a few questions before we go into the topic.
Absolutely.
You say that this is something people want to look their best.
Absolutely. You wonder in these times, are people able to spend the kind of money? But what's really come on the rise, aside from the traditional larger cosmetic surgery procedures, you've got things like liposuction, tummy tucks, those type of more traditionally plastic surgery-based procedures. You've got this whole category of minimally invasive procedures. And if you look at the data from the last year, those are the ones that are really on the rise. And so what does that involve? Something as simple as a botulinum toxin injection, known as Botox, or a filler to correct a wrinkle or a smile line. Those are all minimally invasive procedures. Now on the body side, these contouring procedures involving either heat or, in this case, cold, can really make a difference, and they don't cost as much as the other invasive procedures, and they're not nearly as risky in terms of what they can do.
That was going to be my next question. Just how risky are these compared to the other procedures?
Well, if you do them properly, the risk is very minimal. For example, with the Coolsculpting procedure, we've been treating these patients for 2.5 years now, and we have very satisfied patients and no complications that are temporary to speak of.
So the procedure that we're going to be exploring has been around, what, 2 years, you said?
Yeah, it was FDA approved probably in 2010 after trials for a couple of years before that. And we were fortunate to have the most access to it. And so we've been able to look at our experience and really benefit from that. And we've been very pleased, and our patients have also. And
are the results lasting?
Yeah, so it's really what you set the patient expectations to be, and this is where if they're coming in looking for liposuction results, that's not going to happen. But if you come in understanding that you're going to get some reduction in fat of a certain percentage, and what you're going to give up in terms of the amount that you might get, you'll gain in terms of the minimally invasiveness of the procedure and the ability to repeat it, obviously, I think you can get to the right goal.
Okay. How does someone actually decide, okay, look, it's time to do something?
Right.
Do they talk to their family physician and then he or she's referred, or can they just call a cosmetic surgeon or specialist themselves and say, hey, look, I've been thinking about this, how do I explore it?
Yeah, there's so many, so many body types. A couple of weeks ago, you had some bariatric surgeons on. It was pretty amazing to see what they did with people who are morbidly obese and these incredible procedures to divert the food and to get out of this absorption that gains them weight. In this step, we're talking about people who are probably in their what they call body mass index or BMI range of 18 to 25. In other words, they're very healthy. They don't have a lot of excess fat. In fact, the best patients for this procedure we'll talk about are ones who are in good shape and they just have some discrete roles such as a love handle or back fat or some area that you can kind of pinch and grab that they want to get rid of.
Okay. What was the age range again?
Well, the body mass index, age range actually can go anywhere. We've treated people in their 30s, and we've gone up to probably in the mid-60s.
I see. Body mass index,
Yes.
18 to 25.
Yeah, and then what that calculation involves just looking at someone's height and weight and determining where they fall on a scale
Right.
in terms of how overweight they are.
Right, and the show you're speaking of a few weeks back, we talked about obesity,
Right.
and the surgeons made it clear that someone usually does not consider doing a procedure when it comes to bariatric surgery until their BMI is 35 plus, I believe was the
That's
figure.
right. That's
so you're able to help people between the 18 and 25 BMI.
I think that's a good number, yeah.
Where their numbers are, they may be overweight,
Right.
but technically they're not in that obese range or that unhealthy range. They're wanting to firm up or make it appear. Why can't they do this through exercise, I guess is my question.
Well,
Why can't they firm up the body?
They can, but there is, genetically, where the fat is positioned in your body. First, it depends on gender.
Okay.
Women and men, there's different in terms of distribution on the hips, or is it on the waist? You can look at the gender distribution. But then there's also the individual variability between people. So some people just will get it and it will not go away. And some of the most frustrating people that come in are the ones that take the time to keep themselves in very good shape, yet they have these persistent areas that they want to get rid of. They don't necessarily want to undergo the invasiveness of, say, liposuction, but they still are bothered by this area.
Okay, well, it should be, like I said at the top of the show, an interesting hour, so stick around. Let's start with this slideshow if we can. The very first slide, and we are introducing this topic called Coolsculpting. Is that the name of the procedure, or is that a brand name?
It's both. Really, it's the brand name, but it's also just very descriptive about what the procedure
Well,
does.
you're exactly right in saying this guy is not overweight at all, but look, you can pinch. We all can do that.
Right.
So why would this person want to have his area firmed up?
Again, you've got these areas, love handles, lower abdomen, even on the back, where people just they just don't like, when they're looking at a profile, they don't like what they see in terms of the bulge. And you can pinch an area. Now, the key is you need to be able to pinch skin and fat. And some people, we've had to turn people away for several different reasons. You want to be very selective when it comes to these procedures, because you don't want patients to go down the road and say, hey, well, this didn't do anything for me. And I think you can eliminate that by being able to pick people who really are good candidates. And
Okay, so on the right-hand side of the screen, that's more than just skin then. Is that what you're saying?
That's right. By pinching that, you can actually feel, and this is where having some medical expertise comes in and doing these procedures, you can actually feel what's there, and then you can make your decision based on that. Now, there's certain parts of the body where, and certain distributions of fat where it becomes harder to pinch, and you have to take that into account. But you can see us pinching and then treating that exact same area on the right with the applicator itself.
Okay, so what is going on here, and how long is that device on the side of the body?
So once we identify an area of trouble, whether it be defined roll or a little bit bigger than that, we can place this applicator on there, and that applicator will adhere itself via vacuum suction. And once that seal is made, the skin is brought into the applicator handpiece, and there's cooling plates that take that skin and gradually cool it down.
For how long a period?
That process right now takes an hour per area.
So that person is standing and having that...
Not standing. So actually, you can position people very comfortably. 99% of our treatments, 100% of our treatments are done with patients lying down. So they have an hour to lie down and just do whatever they want while the procedure's being done.
Do they feel that suction?
Yeah, initially the first 8 to 10 minutes, and I did this myself about 4 weeks ago just because I wanted to know myself after all these years. I wanted to see what people are talking about. There is some initial suction. There's initial discomfort as the cooling takes place. Once you get colder, you actually get numb, and so you don't lose. About 10 minutes in, you're not feeling really anything.
Okay. And then how often do you have to have this done?
Yeah, so the procedure cycles for an hour, which is required, the time required to cycle the fat layer down to a temperature which is somewhere, I think, in about the 38, 39 degrees Fahrenheit range, which causes the death, and we'll talk about that. But
okay.
That's the reason for the hour. The incredible thing is the engineering is such that the surface of the skin, which is the epidermis and dermis, there's 3 layers of the skin. What we're trying to do is traverse to the top 2 to get to the fat.
And you do have some slides that are going to point that out, too.
I do.
But I guess what my question is, once that person has had this hour procedure, do they come back next week and have it done again?
No, typically it's a process of 2 to 3 months for gradual resorption of that area. So we actually tell people don't come back. We want them to wait for a couple months and see how it is, see how they like it. It can be repeated, and there's some recent studies. There's one I was just reviewing the other day that shows that second procedures do give a benefit in certain parts of the body. For example, the abdomen. A second procedure has shown some statistically significant improvement in that area. So.
Well, once you've had one side done, do you come back next week to have the other side?
No. So what we want patients to do is it comes down to scheduling and how they're going to schedule their time. But we typically will do 2, maybe 3 areas at a time, whatever the patient wants to do. So
Got you.
when they come in and they lay down and they get one side treated, they might take a little break, get the other side treated, but typically they're there for either some patients say for the morning.
Okay.
So they can either do their work on a wireless laptop. Some people watch movies. We've got movies, videos on demand. They can pick one of those. So it's really it's amazing what you can tailor this to.
Yeah, I was ready to ask, can they actually sit there and watch a video?
Absolutely. They can do whatever they want, books.
Yeah.
It's amazing in this day and age you can sit there and this is happening in the background and you're just completely oblivious.
Okay, let's go to the next slide. So the procedure basics, as Dr. Munavalli continues to explain what this is all about.
Yeah, so this is reiterating what we talked about. The first 7 to 10 minutes is where you get this pulling sensation. And you get a little bit of discomfort as the vacuum engages. Once the temperature starts to cycle down, as you know from being out, we're out in the cold weather, our fingers and toes get a little bit numb. That's what's happening here. And you don't have any sensation. You don't have a sensation of pain. You don't have a sensation of pulling or anything. During that time period, over the course of 60 minutes, the temperature cycles down slowly as the heat's extracted from the fat layer. Instead of cooling things, we're actually pulling heat out, is what how the engineers describe it. So that layer goes down 4 degrees C, somewhere in that range, 38, 39 degrees, and those cells are irreversibly damaged. Once that happens and the hour's over, the cycle's complete, the device comes off, there is a bulge there that's there for approximately 20 to 30 minutes. Looks just like what we call a stick of butter. It's there and it kind of melts back in. By the time you leave, you're just a little bit red. That's about it.
And I see triglycerides up there, fat cells.
That's right.
Is there a health benefit to getting rid of these fat cells, to getting rid of the triglycerides? Because we all know that when we go in for blood work, we're told, okay, your triglycerides are this number.
Right. It's quite the opposite. One thing they were concerned about with any lipid or fat treatment procedures, fat cells are there for a reason. They're there to store our body's caloric intake of fat and triglycerides and free fatty acids, those type of things. So what happens when those are released? Is that going to spike in the serum? Is that going to cause any issues with the other parts of our body? And an interesting study they did a couple of years ago is they went from 1 day all the way out to about 3 or 4 weeks, and they took serial blood levels looking at serum and liver enzymes, and nothing had changed. And so, the question remains, where do the calories go? We're not sure. What we suspect happens is these triglycerides get remetabolized back into other things that are used for the free fatty acids and so forth. But there really is no health benefit because these are localized. The health benefit would come if it would decrease your serum lipids, which obviously it does not.
Okay.
But on the flip side, it's very safe to do because there's no accumulation of serum lipids and no accumulation of liver enzymes detecting liver elevation.
All right. Let's go to the next slide. This is a close-up of what I guess the fat cells look like, these triglycerides, and this is before the procedure.
Yeah, so we're very scientific when we take these technologies on and want to look at them and see what they're doing at the cellular level. And this looks like a honeycomb. If you didn't know better, you'd think this was a bee's hive. But this is actually a biopsy of the skin, and specifically of the fat layer. So you get down a couple millimeters into the skin, and you start to see the fat, which is this lattice network of cells that have basically a really small nucleus, but the bulk of the cell is devoted to storing fat.
What is the red line through there?
The red line are these, what we call fibrous septae, are they're individual kind of compartments in which these cells lie. So the cells typically, it's very hard to see, but they're nice, healthy, round, they're clear, and this is what a normal biopsy would look like.
Huh, okay, and then after the procedure, this is 90 days following that procedure, the red lines disappeared. Is it like defragmenting your computer?
Well, probably this has been taken from a different site that didn't show the compartment, that membrane. That's probably what it was, because that membrane would still be there if they were at the exact site.
I got you.
But what it is showing is that these cells are no longer this regular, nice, round shape. They've gotten damaged. So by getting damaged, their membranes starting to get more permeable. And
looks like they're beginning to break
wither
up.
away. Yeah, you could consider it breaking up and kind of withering away. And if you look close, I mean, you actually start to see some other cell types coming in, and that is our body's inflammatory response, and that's a normal part of this process.
So what's the goal here? Just to dissolve the fat away?
Yeah, the goal is to take a certain number of these cells, and the studies have shown anywhere between 20 to 30% of the total number of cells in that given area will get cooled to the point where they wither away, and it's called a programmed cell death. So they'll go away, and the inflammatory response will remove them.
And this all happens within that 3-month period?
Correct. 2 to 3 month period. We've had patients as quickly as 1 month. I had a patient just the other day who wanted to come back sooner because at 1 month they saw a tremendous difference.
Now, if someone's dieting during this process,
Right.
during the rest time period,
Right. That's true.
Does it speed it up?
Yeah, so how do we know? When you come back in, well, it's easy. We will get you on the scale when you come in. So we'll get you on the scale. We might even measure you. We want to know what your baseline is. Because you come back, it's a great point, because people will start a lifestyle change. You know, anytime there's, I hate to say it, but anytime there's money involved in doing things,
It's
there's
an
actually
incentive.
this extra motivation, incentive to change the other parts of their life they don't like. So they may very well go on a diet. They come back in, they're 5, 6 pounds lighter, and they say, "Hey, I look great. This treatment worked great." Part of it was the treatment, and part of it was the person.
What happens on the flip side if someone gains weight during this 90-day
Yeah,
period?
so they come back in and they're not too happy with the procedure. They don't see much of a difference. On the scale, it shows an increase. Then we know there's a discordance, a mismatch there between what they're taking in and what's kind of been destroyed.
So they have to help
They have to help.
the process
They have
along
to help. Yeah,
by taking care of themselves?
It's magic, but it's not quite that type of magic. So.
And once again, I guess the whole focus of this is for someone who feels they can't get rid of this love handle, no matter how much exercise they do, no matter how twisting of the torso, it's not going to go away? Is that true?
Basically, there are areas, and love handles are one, and the FDA approval for this device is indicated for love handles, but it is used all around the abdomen, very commonly in terms of off-label usage. So the lower abdomen, the stomach area, even upper abdomen, and even the back, the flanks, this device can be used. So everything distributed around the trunk is fair game, really.
Is this procedure for someone who's lost a tremendous amount of weight? They were extremely obese. They lost the weight, and all of a sudden there's a sack.
Yeah, so good point. So a couple weeks ago they talked about that. When you lose a tremendous amount of weight, you've got to deal with the skin, because the skin has expanded over that time, and now you're removing the fat, so that skin is there in excess. So this procedure won't help those patients, because
That's
the
a different
excess skin is
procedure.
going to really need to be cut out.
Okay. So this really is a procedure for someone who may be a little overweight. They're also maybe athletic, or perhaps they have taken care of themselves, but they want a firmer look.
That's right.
How many people does that call to? What's the percentage out there?
Surprisingly high number.
Is it?
Yeah, what we'll do in the later part of the show is go through some patient examples.
Okay.
And I'll show you what patients look like. And you'll see everybody from the patients who are very much in shape, they could be you wonder why are they even worried about this, to people who have a little bit more substance who still would benefit from it. So there's definitely a range there.
Okay. Once again, you're welcome to join this hour with a discussion by calling or sending me an email or a tweet. Let's go to the next slide, and we are going to start looking at some examples here. Slide, this shows some of these perhaps may be graphic to you, ladies and gentlemen, but it's to show a point here of what the procedure does.
Right. When you're looking at these slides, we try to do everything in standardization. So when we were getting started, we with any new technology, you've got to wonder, does it work and is it safe? And so first question, is it safe? Next question is, does it really work? So we took a patient and actually treated one side, and you can see the arrow. And in fact, without
On the
arrow,
left-hand side, you see the arrow.
And without the arrow, you could probably pick out a difference between the two sides.
You really can tell a difference.
Right.
So what has the procedure done here?
Yeah, so the procedure has removed that roll that is on the left side as a result of one treatment, whereas the right side, which was kind of used as an internal control, the patient just said, "I'll just wait. Let's see how it looks like. Let's see how it looks after a couple months," and there you see the result of that. So it's a marked difference in one side versus the other side, and when the other side was treated, it looked the same, and that's I think in the next picture, but you definitely can see a difference here. So that told me, and it told the patient, more importantly, but it told all of us that we're definitely onto something here.
This is the same patient?
Same patient, and with the other side treated, and if you look at them, they're in good shape anyway. I mean, I would love to be in this kind of shape. And
right.
If I remember correctly, she was in her late 50s, so this isn't somebody who is she was active, very active, but someone who had been through and just still wanted to look her best, maybe even early 60s, but late 50s for sure, and with really three treatments, maybe 3 treatments. I think she had 1 on the abdomen as well. You can see a pretty marked difference in the definition.
The before is on the left.
That's right.
And the after is on the right. And
That's
you
right.
might not be able to see the arrow, ladies and gentlemen, but tell us what we should be seeing here.
Yeah, so what we're trying to focus on with the arrows is showing the areas that were actually treated. And so one of them is one of the flanks, and then a little lower on that same side, and then trying to point to the abdomen. But even if you dismiss the areas and just kind of look, you can see a difference in contour on both
Okay,
those
so
areas.
I think I see what you're saying. So that was taken on the left after the procedure. That's why
Correct.
it's a little bit red there.
Probably redness was from the clothing. When you wear clothing and you come in and take them off, if they're tight-fitting clothing, you
before
get a
the
picture.
procedure. Okay.
That's right.
So after the procedure, and this would be 90 days later, correct?
That's correct.
Okay.
That's correct. So it's a gradual
You can
improvement.
see the difference there.
Right. And she was thrilled, and we were thrilled. And this is someone who's very active. So.
All right. Let's go to the next slide if we can. This shows 3 pictures. Is this all the same patient?
So this is all the same patient. So this is taken. This is not one of my patients, but this illustrates that the love handles are one area, but the abdomen is another area. And if you look and follow this patient out, 30 days after, and then 180 days, I believe that says 150 days after, with a single treatment, you see that substance that kind of it's again, this person's in great shape. There's no doubt about it, but they wanted to improve the way they looked, and they got rid of that troublesome area at the lower belly.
So from the before picture to the extreme left to the 80 days out?
Right.
There is a difference there. Has that person also been doing sit-ups, exercise, in addition to help thinking that procedure alone is going to do this?
They typically don't change their lifestyle that much.
They do
So
not.
they're not going to go and they're not going to increase their number of hours in the gym. That's not going to help their outcome. Most of them want to see what the procedure has done on its own merit.
All right. Before we go on with more slides, exactly what does the procedure do? You say it helps just dissolve away these cells after that cooling hour treatment. How does that work?
That's right. So the fat cells basically will reach a point at which the temperature irreversibly affects their function, and they cannot recover from that. So just to describe what happens, in birth you're given a certain number of fat cells. Over the course of one's lifetime, you don't increase that number, but as you eat, as you grow, and as you eat more, gain more calories, and you change, and you get taller and weigh more, the cells start to get bigger, and that's what happens. Just like muscle cells, they'll get bigger, but they're absorbing calories. So when you knock out these fat cells, they don't come back in those areas. So
And is that unhealthy to the body as a result?
no, the body has fat in many different areas, even in areas which we can't reach inside the abdomen. So there's a lot of different areas to store fat. And again, we're talking about a 25% reduction, so it's not as though the entire layer is being eliminated.
All right. So it's in areas that people feel more comfortable.
That's right.
That they're going to.
That's right.
I wish that I didn't have it here.
Right, and it really shows in people's clothing. That's a big thing we hear, a common theme we hear for all of our patients is, you know what, my clothes fit better, I can go down a notch or two in my belt. It's a big difference for me.
Okay. But you're saying that even for people who have lost weight and feel that same result, we're talking a different game here. These are fat cells that are trapped or areas that aren't going to be so conditioned to firming up?
Right, there are areas that are just, for some reason, they're predisposed to maintaining their shape and their structure, and you can exercise, and I'm all for exercising. I think, in fact, the patients that I'm most excited about are the ones that we know are putting in all that time and energy to get an improvement on their own. It's just that they have areas, and in men, I'll tell you, it's around the trunk. In women, it can be it can be in areas, it can be on the arms, it can be the thighs. And unfortunately, this device does not address the thighs that easily. So, but it can also be in the love handles, and so these are areas where you can really, those patients will benefit dramatically.
Okay, we're taking a tweet here, and perhaps we've already addressed this, but let me ask you, how much weight loss is considered a tremendous amount to qualify?
You just have, when you come in, we typically do our consult for this, and I will try to see all the patients that come in because I want to make sure that, and it really is up to what we see. It's you can have a history of a lot of weight loss, and I've seen people that have lost 20, 40, 60 pounds, and they come in, they don't have excess skin, and they look really good. They had gained weight at a period of their life, and then they lost it again relatively quickly, as opposed to someone who's had this overweight, proportions for years, and the skin is stretched. And when they lose the weight, what's left is the extra skin. So there's a time element that goes into this as well. The best thing we try to do is have patients to come in and us take a look.
Okay, let's go to the next slide here, and this shows, I think this is the back region, and this is 2 months after one treatment.
Yeah, so I tried to pick different areas to show where this is addressed. Now this lady, again, is in very good shape, African-American skin, and I've selected this to show you that this skin, this machine, this device is basically colorblind. It's not going to affect the epidermis, and so you're not so much worried about post-inflammatory or post-treatment hyperpigmentation like you would with a laser.
Okay.
That's a distinction I wanted to make. But the arrows are pointing to those rolls, which are kind of extensions of the love handles, but they're coming around the back. And so we actually treated her lying down. She was lying down face down, reading a book or something like that. And then after 2 months after the treatment, there's a marked reduction. And if she steps on the scale, her weight loss will be negligible. So she might have lost a pound or two, but it's where it was lost that's the important thing.
And as you said, it's where they feel comfortable in their clothes.
That's right. Clothes and or bathing suits or, just feeling comfortable with their body. That's true.
Okay. Jerry, go back to that slide. I wanted to point out that in the middle of the back itself, it looked like there was a difference. You could see from the left to the right, there's a difference there in addition to the sides, correct?
Yeah, once they, what's under the fat is typically in most cases some muscle, and so muscle will start to become more defined, and if you look,
it looks like it's ironing out a little bit
You
more.
could argue there's more definition there, and I think that's what you're seeing.
Yeah.
Now, you could also say, well, could she benefit from another treatment? And the answer is yes, depending on where on the body. And a lot of patients will come back, or they'll say, well, if I get improvement now, will I get improvement again after a second treatment? The answer is yes.
This is after 2 months, so
Correct.
Is another month going to make a difference with that initial treatment?
It's so variable and really depends on the person, but we want to give it a fair chance. And so what we say 2 to 3 months before we even consider retreating you. If we treated you at 1 month, we definitely would be in the midst of improvement, and so it would not be the best thing to do.
All right. Let's go to the next slide. Is this the same patient?
Same patient, different angle. And I put this to show that even looking from the side, and she's important to look at these pictures with kind of a skeptical eye because it's very hard in photography to get accurate comparisons between.
But you can tell the difference.
But you can tell a difference. You can tell a difference. The before picture is obviously on the left, and the after is on the right. There's a little bit more light or exposure on the right, but even with that, you can see that the fold is definitely reduced. And you say, well, what's the big deal with that? Well, this person didn't want surgery. They didn't want any injections. They didn't want needles. They didn't want any cutting. And even in darker skin types, it makes a difference. Every time you puncture the skin, you can leave a little bit of darkness there left behind. And so there's no trace of that here.
What's the reaction of the patients when they realize, well, maybe this is working, or do they even realize it's working before you show them the results?
Some do and some don't. We like to take, a lot of them do, and they may not notice it. And what I'll tell patients, if for a visible improvement, if that's what you're going for, where you're going to lose a lot of bulk in an area, this definitely isn't the procedure. Liposuction, which we do in our office, have done for 10 years now, reduces by 70 to 80% in an area, as opposed to, say, 20 to 30%. So that's what you're looking at in terms of an invasive procedure to a non-invasive procedure. But if you want, gradual improvement in an area without the downtime associated with anything, it's a good, really good, viable option. People will say, they'll either say they notice a difference visually, or they'll say their clothes fit differently. Those are the two big ones we hear. Sometimes we have to bring people back, and they don't know if it worked or not, and that's why we take pictures. And when we show them, they're really surprised. Since it's a gradual thing, your body can accommodate to that. You may not realize it.
Interesting. Well, it's a fast-moving hour, and we have another half hour to share with you. You're enjoying Healthwise right here on WTVI.
An educational grant for Healthwise is provided by dermatology, laser, and vein specialists of the Carolinas.
And by the Mecklenburg County Health Department, and by viewers like you. Thank you. If you would like support group information about tonight's topic or any Healthwise topic, call SupportWorks at 704-331-9500.
We're exploring non-invasive body sculpting. Are we ready for prime time? With us is Dr. Gilly Munavalli of Dermatology, Laser, and Vein Specialists of the Carolinas. Interesting hour. You've been able to show these before and afters, and we have more to share with you now with a procedure that's called Coolsculpting. And it's an hour procedure where you take perhaps a piece of love handle, and it's cold therapy for any viewers that we have that have just tuned in. Let's just give a little wrap of what we're talking about.
Quick summary is this device cools the fat layer and, or actually extracts heat cooling the fat layer, and those fat cells, which are very susceptible to cold as opposed to, say, muscle or other skin cells, will reach a point of irreparable damage and they'll die off. And over the course of a couple months, they just basically dissolve and are absorbed away, and that results in a decrease in the fat layer.
And these are fat cells that will not come back. And you say that that is not a health issue?
Correct. I mean, liposuction, which has been done now for probably in the order of 20, 30, maybe even 40 years, where they're removing much more vast amounts of fat cells. What studies have shown using CT and other imaging, you can see that even with that marked reduction in fat, there's no abnormal collections to the point where it compromises your health. So if you look at one extreme and then compare that to Coolsculpting, which is just removing 20 to 30% of a fat layer at any given time, it's easy to see that it's not compromising your health.
Okay, let's continue with the slides if we can. The next slide shows a before and after. On the left-hand side would be the before, I would assume. You tell us.
Yeah, we try to put the befores they're marked here. And so this is it's a little different body habitus than what we've shown you. So what we've shown you up till now are people who arguably in very good shape anyway. And this person is too. This person might have what we call a body mass index, which is calculated by your height and your weight. This might be somewhere in the 20, 22 range. And this person is generally speaking very healthy, but they didn't like their stomach.